Could artificial intelligence help improve IVF success rates? Could AI help select embryos, personalize fertility treatment, or identify sperm in severe male infertility? It may sound futuristic, but reproductive medicine is one of the most exciting areas where AI is being studied today. So in part 2 of this series, let's explore how AI is transforming IVF, embryo assessment, ovarian stimulation, implantation prediction, and male infertility care. Hi, I'm Dr. Spandana, your OBGYN. In part 1, we spoke about how AI is changing pregnancy care, ultrasound, fetal anomaly detection, and labor monitoring. Today, let's move one step earlier in the journey to fertility treatment and IVF. IVF is a highly data-driven field. Every IVF cycle generates a huge amount of information: age, AMH, antral follicle count, hormone levels, ovarian stimulation response, number of eggs retrieved, egg maturity, sperm quality, embryo development, endometrial thickness, previous IVF outcomes, and sometimes genetic or laboratory data. Traditionally, fertility specialists and embryologists use this information to plan treatment, assess embryos, and estimate the chance of success. AI can analyze large data sets and detect subtle patterns across many cycles. This is why AI is becoming increasingly important in reproductive medicine. Let's start with embryo assessment. In IVF, one of the most important decisions is choosing which embryo has the best chance of implantation. Traditionally, embryologists assess embryos under a microscope. They look at features such as cell number, symmetry, fragmentation, blastocyst expansion, inner cell mass, and trophectoderm quality. This grading is very important, but it can still have some subjectivity. Now, with time-lapse embryo imaging, embryos can be monitored continuously while they develop inside the incubator. Instead of looking at one or two static images, time-lapse systems can capture thousands of images across embryo development. AI can analyze these image sequences and study the timing and pattern of cell divisions. It may detect subtle developmental patterns linked with implantation potential. This can help rank embryos according to their likelihood of successful implantation. The goal is not just to choose an embryo that looks good at one moment. The goal is to understand how that embryo developed over time. That is where AI becomes powerful. It can analyze dynamic development, not just a single snapshot. AI is also being studied for predicting implantation and pregnancy success. In IVF, embryo quality is important, but it is not the only factor. The uterus and endometrium matters too. The patient's age, hormone environment, previous IVF history, ovarian response, and embryo genetics may all influence success. Future AI systems may combine embryo images with patient-level clinical data to generate more personalized predictions. Instead of only asking, which embryo looks best, we may also ask, which embryo has the best chance in this particular patient in this particular cycle. That is the direction fertility care is moving toward: more individualized, more precise, and more data-driven. Another important area is ovarian stimulation planning. In IVF, ovarian stimulation is used to help the ovaries produce multiple follicles. But every patient responds differently. Some patients may have a poor response. Some may produce fewer eggs than expected. Some may have a very high response and be at risk of ovarian hyperstimulation. AI is being studied to help predict ovarian response using factors such as age, AMH, antral follicle count, body mass index, hormone levels, previous stimulation response, and treatment history. This may help personalize the starting dose of medication. It may also help estimate the expected number of eggs. In the future, AI may help answer questions like, how strongly is this patient likely to respond? What dose may be more appropriate? Is this patient at risk of poor response? Is this patient at risk of excessive response? And when may the follicles be ready for trigger? This could make IVF stimulation more personalized and efficient. AI may also help in cycle monitoring. During stimulation, patients undergo repeated ultrasound scans and hormone tests. Doctors monitor follicle growth, estradiol levels, endometrial thickness, and overall response. AI systems may eventually help combine these data points and support treatment planning during the cycle. This is important because IVF decisions are dynamic. The first plan is important, but the response during stimulation is equally important. Another exciting area is endometrial assessment. A good embryo needs a receptive endometrium. Traditionally, endometrial thickness and pattern are assessed by ultrasound. But implantation is complex. Thickness alone does not tell the full story. Researchers are studying whether AI can analyze ultrasound images, vascularity, texture, and clinical data to better understand endometrial receptivity. In the future, AI may help identify whether the endometrium appears favorable for embryo transfer or whether a freeze-all strategy may be better in selected cycles. AI is also being explored in male infertility. Male factor infertility contributes to a significant proportion of infertility cases. Semen analysis traditionally looks at sperm count, motility, morphology, and other parameters. AI-based semen analysis tools are being studied to improve objectivity and consistency. Computer vision can help analyze sperm movement, concentration, and morphology more automatically. But one of the most exciting areas is severe male infertility. In some cases, especially severe oligospermia or non-obstructive azoospermia, finding rare viable sperm can be extremely difficult and time-consuming. AI-based image analysis is being explored to help detect rare sperm faster in complex samples. This could be valuable in selected cases where every viable sperm matters. AI may also support IVF laboratory quality control. IVF laboratories are highly controlled environments. Temperature, gas levels, incubator conditions, culture media, handling time, and workflow all matter. AI can potentially help monitor laboratory conditions, detect deviations, and support quality assurance. This may improve consistency across cycles and across laboratories. AI may also help with counseling. Many patients think of IVF success cycle by cycle, but fertility specialists often think in terms of cumulative probability. That means the chance of success over one or more embryo transfers from the same egg retrieval. AI models may eventually help counsel patients more personally by integrating age, ovarian reserve, egg number, embryo development, embryo quality, previous outcomes, and transfer history. This may help patients understand why treatment plans differ from person to person. Two women of the same age may have very different ovarian reserve, embryo development, endometrial factors, sperm parameters, and previous treatment history. AI can help analyze these differences in a more structured way. So, what does the future of AI in reproductive medicine look like? We may see AI-assisted embryo ranking, more personalized ovarian stimulation protocols, improved prediction of ovarian response, better implantation prediction, AI-supported sperm identification in severe male infertility, smarter IVF laboratory monitoring, and more personalized counseling for couples undergoing treatment. Artificial intelligence is already beginning to reshape reproductive medicine, not as a single magic solution, but as a set of tools that can improve pattern recognition, embryo assessment, treatment personalization, laboratory efficiency, and patient counseling. The future of IVF may become more precise, more individualized, and more data-informed. And this was part 2. In part 3, we'll move into gynecology. We'll talk about AI in gynecologic ultrasound, endometriosis, ovarian masses, cancer detection, surgery, women's health apps, and the future of women's healthcare. What do you think is the most exciting use of AI in IVF? Let me know in the comments below. And if you found this video helpful, don't forget to like, share, and subscribe for more evidence-based women's health content. Thanks for watching, and I'll see you in part 3. For more doctor-explained videos on pregnancy, fertility, IVF, and women's health, subscribe and stay connected. Always consult your doctor for personal advice. Thanks for watching.